One of the most common problems that I see in my clinic is the problem of cannabis. People smoke cannabis and they claim it helps calm down their anxiety, helps with their emotions. They think it helps with their mental health. Well, I'm Dr. Anthony Collada. I'm a board certified psychiatrist, and I'm going to share with you why some people who are struggling with mental health problems should not be smoking cannabis. Now, I know cannabis can help to relax in the moment. It can help people to feel a sense of calmness, sense of high. Maybe people use it to wind down at the end of the day. They use it to help with sleep. But there are so many psychiatric problems that can come as the side effects of cannabis. For example, just take cannabis withdrawal. Cannabis is in this body system for a certain amount of time, but there's a withdrawal from it that can lead to irritability, can lead to anxiety, can lead to anger. Not only that, it can affect motivation or make people's motivation less. This is just a well-known side effect of cannabis. That's the effects of cannabis withdrawal. Even cannabis intoxication can cause people to get psychotic or have bad trips. Maybe they get paranoid. Maybe it resolves quickly, or maybe it can linger for weeks or months later. Also, when you use a chemical like cannabis to help cope with stress, or to try to help cope with stress and the difficulties in life, then maybe you could be doing something that's healthier or more constructive for not only yourself, but those around you if you didn't use that substance. For example, if there's a lot of built up emotions or tension, maybe you can talk about it through therapy, have a journal, maybe take some time to exercise or focus on eating healthy or some self-care technique. Maybe it's helping something in the community. But there are so many other ways that people can use stress or deal with some of the emotions or frustrations they're feeling rather than resorting to cannabis. Some of the most common mental health problems I see people struggling with that cannabis can cause is anxiety, ADHD-like symptoms, low motivation. Also, cannabis is a gateway drug, whether people like to believe it or not, to harder drugs. People at younger ages may get exposed to cannabis first, and then they get associated with maybe the wrong crowd or people who are doing other drugs. And it can just lead to really disastrous consequences. Not only that, the long-term side effects that can happen psychologically of using a drug like cannabis can really impact people's health. If anyone is struggling with a mental health problem, such as anxiety, depression, a mood disorder, and really any mental health condition, it's so important to be sober from drugs like cannabis, because that'll help to get clarity of what the actual diagnosis is and what medications to treat. Because if cannabis is causing some of the mental health problems that someone is presenting with, then it's going to make it more difficult for the clinician and the patient to work together to find the right treatments that will help them in their condition. Now, I know there are some rare exceptions of cannabis for certain medical purposes, like maybe for chronic pain that isn't able to be treated with other medication types. Maybe it's people who have a low appetite that are undergoing chemotherapy treatment that are on cannabis-like medications. And so there are very few exceptions, but typically for psychiatric conditions, at this time, there's no indication or no reason to be using cannabis. In fact, psychiatrically, we often find it causes more harm than good.